Welcome back to The Line. President Trump and Republican leaders in Congress have been saying for weeks that a repeal of the Affordable Care Act is imminent, and that could have a significant impact here in New Mexico. Governor Martinez expanded Medicaid eligibility in the state under the ACA, as you recall. It's unclear exactly how or when New Mexicans might see major changes. Sophie, on this insurance access, this is big-time stakes stuff for us. This is huge for us if you think about the sheer numbers of people.
It is huge for us. I mean, when you think about it, prior to adoption of the ACA and the rollout of the ACA, New Mexico was the most uninsured state in the country. We were the worst. Now, we hit 50, and sometimes 51 on a regular basis. That is not an okay thing, an okay place for us to be. Now, just under 10% of New Mexicans are uninsured. That's an incredible jump that we've seen, and it's an incredible bit of progress. Our economy, you know, to the extent that we've had new jobs, kind of a lot of them have been in healthcare. And so for us, the uncertainty, will I keep my insurance, but also will I keep my job? Will we have the resources to continue programs like the Medicare, Medicaid, I always get them confused. Expansion. I always, yes, thank you. The Medicare expansion. And so, you know, will I see a huge chunk coming out of my disposable income, what I use to feed my family, pay my rent, et cetera, because I have to pay so much more now for insurance. And the big question that looms over all of this is, how long will it take for the Republicans in Congress, for President Trump, to come up with something that will help to sort of settle those questions?
Right, repeal and replace.
What will it look like?
Yeah, exactly right. Merritt, interestingly, when you think about our situation and the situation Sophie just mentioned, one of the things that I find interesting going on out there is this confusion between Obamacare and the Affordable Care Act. That folks think it's two separate things, and that Mr. Trump and President Trump, has been talking about one but not the other. So when the chickens come home to roost, what do you think is going to happen here? I mean, there's talk that this could be dicey for folks in the midterms if it turns out there's not a credible replacement out there for folks.
I think the big question for New Mexico is what happens with the Medicaid, because that's where most of the insurance has come. For those who have to go into the exchanges, it's been almost punitive. For those operating the exchanges, it's been a punitive effort. We've seen a company, I think it was New Mexico Health Connections, that kind of set itself up specifically to work within the exchange. They were on board. We were a private sector going with the public sector, and we're going to make this work. And they get ridiculous fines. In their mind, in my mind, I agree, for having too healthy a population. So they're not allowed to keep any savings they've had managing health care as they see fit in the private sector. So I think the Medicaid issue, it was a risk when we did it. It remains a risk. It would be a risk even if ACA/Obamacare, they're the same thing, remained as it were. The Medicaid issue would continue to be a risk for New Mexico. What it's done for employers, I was on the board of an agency employing the severely disabled in El Paso, and we provided an on-site health clinic, because we discovered when people have health issues, if they can get primary care taken care of at work, we have less absenteeism. So it was a better program for us. Under ACA, which is also known as Obamacare, they're the same thing.
To repeat. Wait. PPACA.
Basically, we got no credit for operating that clinic.
Right.
It did not count toward us as an employer. And the recommendation was to shut the clinic and pay twice as much to provide lousier services for a vulnerable population.
Only the government.
So, the system crashed. People couldn't register. So it was an important step forward, but it certainly has been flawed in its implementation. So I think for New Mexico, whether it's repealed or not, it's not a huge change.
82,000.
I couldn't disagree more.
Finally,
let me just paint a picture. This is something I actually know about, and that is if the Affordable Care Act is repealed without a replacement, Medicaid expansion is rolled back, 270,000 people will immediately lose health care coverage, New Mexicans, most of them children. 40,000 people who get their insurance coverage through the exchange will be out as well, because the exchange will surely shut down. And between 6,000 and 19,000 people will lose their jobs here in New Mexico. That's what the estimate of the Urban Institute is, which says that it may cost New Mexico $2 billion a year without this program, which has been mentioned was its only source of economic growth in the past 4 years here in New Mexico. So, I mean, without a replacement, if the mandate is repealed, if insurance companies are allowed to reinstate annual limits, refuse people with pre-existing conditions, reinstitute lifetime limits, the price of insurance is going to skyrocket in the individual market. People simply will not, and it has. The ACA has been the only thing that has kept the finger in the dike. Without of it, the cost of medical care will and especially insurance, will completely skyrocket, especially on the individual market.
Do you think it's without that mandate, your proposition is it's impossible to keep rates where they are now, and certainly not going to go down without that mandate. But that mandate's a tough one to get around in Congress at this point, it seems to me. So where do we go from?
But it's not
what
just
can you
Dee
possibly
who says that, it's economists.
Well, that's
You
true.
know,
That's
people
true.
who study
Yeah.
this issue.
Yeah.
Right, and the mandate was the only reason that the insurance companies accepted the reforms in the Affordable Care Act. The reforms were considerable. They limited the profits of insurance companies to 15%. That'll be gone. Now insurance companies will be able to use more than
Insurance companies were leaving in droves anyway.
I would say, and the profits, they are increasing costs. They may still say that I've got a 15% profit, but we are talking about insurance. We are talking about a massive make-work project, pushing paper, and people are not getting to see the doctor. That's the truth.
Are we in agreement then that single payer is the way to go? Just cut out that middleman? Is that where we're going?
Well, I say
because more and more when you talk to people around the country, the polling suggests that that is actually what Americans want. They want the single payer, cut out the middleman, make sure, you know, Medicaid for all, Medicare, like VA, the equivalent of VA services for all. We shouldn't have to deal with
Well, I would say so. Let me just stop right there, because having been a recipient of military medicine, and then that single payer.
understand, yeah.
But I'm just telling you that there are pieces that are not perfect. At the end of the month, there may be no money because it's already been used up. They can only schedule 30 days out because the money runs out.
Interesting. I have a question.
And so just so you know, that's how it works.
I have a broader question. It just strikes me, and I'm lucky enough to sit at this table with all women. Back in the bad old days, before there was this situation, women could be charged more for insurance.
Absolutely.
Correct.
Absolutely. And
You know what
we're
I mean?
charged more. Maternity benefits were
Right.
not automatically included in insurance policies. And that's what's going to happen now. I can just foresee the replacement, if there is one, is going to be very slim, pared down policies without a lot of benefits. The deductibles and the premiums, co-pays will still go up. But the policies themselves will be much slimmer because the ACA mandated certain benefits like maternity benefits and other
contraceptive,
benefits.
100% coverage for contraceptives.
That's right.
Yeah.
But when you think with the Republican-controlled Congress, we have a chance to slide back a little bit on these.
Are you
things?
kidding? Are you kidding me? We have a candidate to run the Department of Health and Human Services who is very much on record saying things like, you know, no woman can't afford to pay full boat for her contraception. I mean, I think, and who frankly opposed contraception coverage in general, opposes contraception itself.
He's on the record. Yeah.
And so, you know, should we expect that sort of thing to be dialed back? Absolutely. I think we would see a huge change in coverage for women.
Merritt, do you have a thought on that?
Well, I've been providing health care and struggling because I have employees in different states, which ACA, also known as Obamacare, never touched.
Right.
Being able to pool interstate. So I've been paying through the nose for insurance for my employees. As an employer, I have seen my rates steadily go up. ACA has not made a big difference. The plans I have always covered maternity care and contraception. And as an employer, and that's how a lot of people expect to get their insurance, it's my choice to offer those benefits, and that's how I attract employees. And I think for when we look at in a single payer system, of course, that would have to be covered. I'm very against single payer. In this hybrid system we have now, I think you have to select the plan that works best for you. It's not a flat-out given.
Right. Janice, we live in a 1099 nation right now, so-called.
Thank you for going there.
You know what I mean? So given what Merritt just laid out, what happens in 1099 nation when people are trying to get insurance? You know, a lot of folks don't have the benefit of a boss who cares. You know what I mean? It's a difficulty.
I would say let me just rephrase that. The IRS and the tax code should not be involved in your medical care. That is, you know, and I appreciate that they felt like the only way we could get compliance was to make it a tax program, which the PPACA, it's the Patient Protection and Affordable Care Act, let's call it what it is. That was the only anchor to it. Yeah. And that's, so now what we have is, we do have a lot of insurance out there. I'm not sure that all of the children who need to be seen are being seen because of this, and they still go to the emergency room. But what I am seeing is a lot of younger people who are starting who have a $6,000 or $10,000 deductible, and they're paying between $500 and $800 a month, and don't go to the doctor because they can't afford the deductible.
That's right.
What did we do?
That's right.
What did we do?
Does that change fundamentally? Again, we can't wrestle this to the ground here, but does that in fact change fundamentally with cross-state insurance like President Trump's talking about? Do you know what I mean? I just have trouble seeing some system that will press prices down.
No,
in that context.
I think it will. I think it will. The lack of insurance subsidies for people to buy insurance will mean they won't buy insurance, and the only people that will want to buy insurance are people who are sick, who don't have an employer. And remember, in the U.S., 22% of the population have pre-existing conditions.
Right.
They are expensive to cover.
Yes.
And therefore, the insurance companies, in order to pay for them, are going to be raising rates across the board.
Well, let me stay with you on a subject then. Steal another minute from the booth here. What do you make of Senator Heinrich's push to get rid of the Cadillac tax?
I think that's right.
He's on the right track?
I think he's on the right track.
Okay.
He started it last year. No one is ever saying that the ACA is the perfect vehicle.
Sure.
It's not the perfect vehicle. Like I said, I think it was an attempt to stick a finger in the dike from what our medical system collapse looked like 5 years ago and may look like in 6 months.
There you go. In a few minutes, the line will debate the balance between supporting transparency in state government with privacy for individuals who are applying for jobs.